Next up, we have House File 469. Representative Moeller, would you like to move your bill to be laid over for possible inclusion?
Yes, so moved, Madam Chair.
Great. I understand that you have an amendment. Would you like to move your A1 amendment to get the bill in the shape that you would like?
Yes, Madam Chair, I'll move the A1 amendment.
Great. All in favor of the A1 amendment, please say aye.
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 Any opposed? Okay, we have your bill properly before us. You may proceed.
Thank you, Madam Chair and members, for the opportunity to bring House File 469, the Seizure Smart Schools Bill, before the committee. The bill has bipartisan support, and thank you to Representative Baker and the Epilepsy Foundation for bringing this important issue to my attention. We know that 1 in 10 people will have a seizure during their lifetime, and that here in Minnesota, over 7,000 children are estimated to live with epilepsy. Today, many teachers and staff lack the tools and awareness they need to recognize and respond appropriately to seizures that happen at school. This bill helps us fix that problem by increasing access to training materials for school staff and ensuring students with epilepsy have a seizure action plan that guides the response they need from those around them. Free training materials and guidelines for schools to be seizure smart are already available and being used in schools across Minnesota with much success, but unfortunately they're not being taken up equally. And our hope is that this bill ensures that students with epilepsy from all backgrounds are safe in the school they attend. This is a cost-neutral proposal, and advocates have worked with key stakeholders over the past 2 years to shape consensus language that brings us to where we are today. And I'd like to thank those stakeholders and the Epilepsy Foundation for working on that language. I'd like to just point out the bill is drafted in a way to give schools a lot of flexibility in implementation. For example, the identification of an employee at each school site could be the identification of a particular position rather than a specified individual. And similarly, the school day is not specifically defined and can be determined by the school. The bill does not create a duplicative process, as it wouldn't require documentation in addition to a 504 IEP. If this information is included in one of those, that's sufficient. The ultimate goal here is to make sure there's a plan in place to have someone with knowledge of how to respond when the student is at school. And by bringing awareness of epilepsy to the education community, students living with epilepsy or seizure disorder can feel safe in school and reach their full academic potential. And with that, Madam Chair, I have a few testifiers ready to go.
Thank you, Representative Moeller. I have on my list Tricia Zeller. Please introduce yourself for the record and proceed.
Hello, hopefully you can hear me. My name is Tricia Zeller, and today I share my family's personal story and support for House File 469 Seizure Smart Schools legislation. I reside in Chanhassen. I'm also the Vice President of the Board of the Epilepsy Foundation of Minnesota. But most importantly, I'm a wife and mother of 2 fantastic daughters. My youngest daughter, Rachel, who should be on the screen here somewhere, you can see is 14 and an 8th grader at Pioneer Ridge Middle School. She's a tenacious young lady, works very hard, has a kind, empathetic heart, but also Rachel has epilepsy. Without medication control, Rachel has over 300 seizures a day. Most of her seizures are controlled through quite a cocktail of medications, and my family lives by alarms, ensuring she takes her medications as close to 12 hours apart as possible. As a parent with a child with special needs, every day I'm steeped in worry and concern for her health and well-being. Epilepsy is a very inconsistent neurological disorder. You never know how, when, or where a seizure will strike, and when it does, you pray that she's in a safe and secure environment where she'll get immediate emergency care. This pandemic's definitely challenged us over the last year. Distance learning was not a term I even knew a year ago. But as difficult as this last year has been, there's been one large silver lining for my family, and that Rachel has been home under our care, which is one less worry when she has a seizure, and the people around her will have the training and fundamental understanding of what emergency care she needs. Tomorrow, however, Rachel returns to physical school 2 days a week in the hybrid model, and my anxiety and worry will quickly return. Will Rachel be safe and receive the care she needs in school should she have a seizure? Today, I'm asking each of you to be proactive, to lead your colleagues in the House and support this bill, protecting all Minnesota's students. Seizure Smart Schools creates legislation and a framework of ensuring all schools and districts in Minnesota can access epilepsy response materials to protect their students. As the nurse's office has Band-Aids for potential wounds, they should also have access to Seizure Smart training materials so they know how to effectively respond to seizures and their epileptic students. If Seizure Smart Schools saves one child through proper emergency treatment and care when a seizure happens, it's worth it. This is not a partisan issue. It's the right thing to do. As a parent, I want Rachel to be happy, experiences the joys of learning, but most importantly, above all, we just want her to be safe. Thank you.
Thank you for your testimony and your willingness to share your family's personal story as well. Up next, we have Lindsay Ballou.
Hi, thank you, Madam Chair and members, for having me here today. Sorry, I should have gone first, so I didn't feel that safe when my daughter's at school. My name is Lindsay Bolio, and I am a parent of a student with epilepsy. Elise had her first GTC, or grand mal seizure, at 14 months. She is now 9 and has had thousands since this. Her diagnosis is Dravet syndrome. We have exhausted all medications and are awaiting a clinical trial through the mail. Prior to Elise entering kindergarten, I spent hours and weeks making sure that the staff was ready for her. Knowing after speaking with the Epilepsy Foundation, they gave an in-service to her school. So they were prepared, or a majority of the staff were prepared for her arrival and how to administer her rescue meds. She is now in 3rd grade, and her staff, and frankly, all the staff at the school at this point, know what to do when a seizure occurs with her. But it took a lot of work to get there on my end, and it would be really nice if there was an overall plan in place for schools to have general training. She finally went back to in-classroom school on January 25th, and the head nurse had enough foresight to train all of the staff on Elise and her situation. So if someone had to quarantine, there would be additional staff that already knew what to do. I, the nurses, and her special education teacher, and her paras have spent so much time trying to educate others. It would be wonderful if it was already in action, that the schools had the resources they need so my daughter and other students can stay safe. Thank you.
Thank you, Ms. Bolio, for your testimony. And thank you also for being willing to share your family's story with us today as well. We appreciate you doing that. Up next, we have Nikki Baker.
Thank you, Madam Chair and members. My name is Nikki Baker, and I am the Community Health Services Director at the Epilepsy Foundation of Minnesota. Thank you for the opportunity to speak in support of HF469 today. Statistically, we know that about 1 in every 26 people will develop epilepsy in their lifetime, and 1 in 10 people will have a seizure. Youth under the age of 18 are one of the leading populations to develop epilepsy, so we can be assured that a seizure response is relevant to every school. For schools looking for a Minnesota-based support, the Epilepsy Foundation has a number of fantastic resources already available for free. Those resources can be as simple as a seizure first aid poster, which is available in English, Somali, Spanish, and Hmong, to a classroom kit that includes educational resources for teachers, parents, and students alike, to live and on-demand trainings for school nurses and school personnel. In addition to local materials, the National Epilepsy Foundation and the National Association of School Nurses also offer free guides and tools on a seizure response. The Epilepsy Foundation of Minnesota has already trained dozens of schools to become Seizure Smart, to help prepare health services personnel, educators, school personnel, and students to recognize and respond to seizures. Our team has provided these free resources to schools across the state, including War Road, Alexandria, Laverne, and here in the metro area. One highlight to note is Waconia Public Schools, which is a seizure smart district. We think this bill is a great step forward and builds upon the successes we've already seen with seizure smart schools here in Minnesota. I thank you for your time today, and I urge you to support HF469.
Thank you for your testimony. Let's see here. It doesn't look like we have anyone who signed up to testify beforehand. Is there anyone else logged into the Zoom hearing who wishes to speak for or against this bill? Please use the raise hand function to be recognized. Rachel Zeller, please introduce yourself for the record and please proceed.
Hi, I'm Rachel Zeller and I have epilepsy. I am 14 and I'm in 8th grade. I have epilepsy. I take lots of pills every day to stop my seizures, but still sometimes I have them. I wish they would just go away. I go to a lot of medical appointments. I hope I can drive when I turn 16. I want to be a canine police officer. I worry at school about having a seizure and people helping me. I know it worries my parents a lot too. They make sure the nurse and my teacher knows to watch out for me in case I have a seizure. Seizure smart schools would make me feel better and safer at school. I hope you will support this bill and make my days a little bit easier. Thank you.
Thank you for your testimony and thank you for being willing to share a little bit about yourself as well. Is there anyone else logged into the Zoom hearing who wishes to speak for or against the bill? Just a reminder to use the raise hand function to be recognized. Okay. Seeing no one else, we'll move on to member questions. Representative Bennett.
Thank you, Madam Chair. And I'm very supportive of making sure that our schools are prepared to handle children who have seizure disorders. And actually in my classroom, I've had that before, had students with seizure disorders. And I'm just curious, so the process when I was teaching was that we would develop a 504 plan for that student, and the student nurse, or not the student nurse, the district nurse headed that up. And part of that 504 plan was to make sure that any staff person who would be in charge of that student, supervising or however, would be prepared if that child had a seizure. So I'm just curious, and this might be a question for the bill author or someone else, but how would this legislation differ from what a 504 plan already requires? Because it seems like, at least in my school district, this was already happening, and I'm just curious the difference here.
Representative Moeller.
Thank you, Madam Chair, and thank you, Representative Bennett. So it's my understanding that if that's in place, that would satisfy the requirements of the bill. But I would like to turn this over perhaps to Ms. Baker to explain why this is necessary in light of those 504 plans or IEPs.
Ms. Baker.
Thank you, Madam Chair and Representative Moeller. There is a percentage of us students that do qualify for a 504 plan and or an IEP plan. We do encourage their seizure action plan to be included to both of those if they are in a place. But I will say that there is a large percent of the population of students that either aren't aware that they qualify for an IEP or a 504 plan and they don't have one, and or they don't feel the need academically or physically to gain that type of support. And so there's a big gap in a youth living with epilepsy of who has those in place and who does not.
Representative Bennett.
Thank you, Madam Chair.
Representative Feist.
Thank you, Madam Chair. I just wanted to follow up on the comments by Lindsay Bolio. Her daughter, Elise, is BFFs with my daughter, Harper. They have known each other since kindergarten, and I remember when my daughter came home and she said, Elise has epilepsy. And I remember that Lindsay sent these emails so that all the parents were informed. And I know just from knowing Lindsay and being friends with her and seeing Elisa's experience in school, just how hard she works to make sure that the school has the training and knowledge to keep Elise safe. And I just think this legislation is wonderful to put just less of that burden on the parents. Because it's hard enough being a parent, and just knowing that all of this would be in place in the school, I think would just take a lot of that burden off. And I just wanted to thank Lindsay for coming and sharing her thoughts, because she is an awesome mom and an awesome expert on this. And so yeah, that's it. Thank you.
Thank you, Representative Feist. Representative Moeller, any last words?
Just to thank again the testifiers, Madam Chair, and I hope members will support this bill. Thank you.
Thank you, Representative Moeller, and I will renew the motion that House File 469 be laid over.